Why does healthcare cost so much in America? And more importantly, what can we do about it? It is probably the most common question I get in my career. So I'm going to tackle it here in this video podcast. Um, I've been a healthcare attorney for 26 years now. I've been a full-time large group healthcare consultant for large employers for 23 years. I actually worked in the industry for 10 years prior to that part-time while I was going through college and law school. So it is something I am intimately familiar with. I've been involved in litigation with insurance companies, with employer plans, with hospitals and medical groups. And prescription benefit managers. I think I've seen just about every angle I could see of the whole system. And of course, it's a complex system designed to be a myriad of administrivia and bloat and really complicated. So this podcast video could go on for way too long. I'm going to try and make it somewhat concise. The number one thing to keep in mind is every single element that touches your health plan. Now, again, I come at this from the group level. So if we talk about like how can we fix healthcare, individuals have no power. They can't. There's nothing they can do. And they vote. I mean, right? But politicians are effectively useless anyway, so it doesn't really help much. There's 2 or 3 good ones out there. Vote for them and hope to God that you water them and they grow. And then of course the government systems are horrific. I mean, if you need me to explain that, there's different videos to explain to you just how horrible Medicare, Medicaid, the VA, TRICARE, all of these government-sponsored programs are people are not happy with them. Medicare generally actually is the one that works decently, but government's not the answer. I think we know that. If you're watching this video, if you know who I am, you know that's not the answer. So, okay. So when you look at a health plan, again, remember, I come at it, I help employers with anywhere from 300 to typically 3,000, but as high as 10,000 employees, set up health plans that minimize the amount of waste and maximize their return, maximize what they can give back to employees and what they can do for total compensation. So the first thing to keep in mind is absolutely every element that touches that health plan has a macroeconomic incentive to keep you using the system, right? If there's truly a cure, if there was a drug or a program or a style of eating or a medical intervention that could cure you, the macroeconomic reality is the system wouldn't want that to happen. Now, again, I have to give this disclaimer every time. There are amazing individuals in the system, doctors, nurses, administrators at hospitals, people that work at insurance companies, other consultants and brokers like me, medical groups, even people that work within CMS and HHS, although there's less of those. No. So here's the thing. Every one of those entities, insurance companies, hospitals, prescription benefit managers, big pharma, government agencies, brokers, and medical groups. 6 entities that touch and manage your health plan. They all make more money the longer you remain dependent upon their services, all right? So you have to remember that. No good deed goes unpunished. Again, you might have an amazing doctor. You might have an amazing broker. You might have a phenomenal rep at your insurance company. They're not going to be able to overcome the Herculean tidal wave that is profit maximization, right? Because here's the other problem. These entities, government, we'll set aside government for now, broker, insurers, hospitals, PBMs, medical groups, most of them, in fact, the vast majority now, are either driven by Wall Street, they're either publicly held, or they're backed by private equity. Okay, so and what that means for those that are not, economic nerds is they have to show growth in quarterly profits. It's deep within their DNA that they have to show growth in quarterly profits. They have quarterly stock price. There's a serious emphasis on grow, and increase your stock price every quarter, not in the long term, short term, every quarter. That is another fundamental truth. I'm not going to go into detail on that, whether you're publicly traded on Wall Street or whether you're backed by private equity. And the overwhelming majority of all hospitals, insurance brokerages, and prescription benefit managers and insurers are in that category. Okay, so you've got a tremendously powerful, intelligent, and now making use of AI at light speed. I have friends that consult with AI companies in this world. They're doing absolutely everything they can to maximize what you pay for healthcare and to keep you in the system, right? To keep you going to the doctor, to keep you taking the drug, to keep you sick. I hate to say it. Your doctor might not be doing that, probably isn't, but the system is set up that way. You just got to understand that. And when I say the system, I'm talking about the largest employer in America, healthcare, the largest lobby in America, healthcare, and the largest piece of our federal government, healthcare. Defense ain't got nothing on healthcare. Healthcare is the most profitable, powerful, and fastest growing industry in our entire country. And it has been since the late 1960s. What happened in the late 1960s? Mid 1960s? Medicare and Medicaid, right? We put a whole bunch of free or nearly free government money into healthcare. And that government money sloshes around. You get a lot of people doing a lot of different things, and you get the Iron Law of Bureaucracy, which I've gone over before. The Iron Law of Bureaucracy is so true. It's true for private bureaucracies and public ones. And what it says is that no matter how noble the goal of the bureaucracy was at the beginning, ultimately the goal of the bureaucracy becomes to perpetuate itself. The primary goal becomes self-perpetuation. And the secondary goal of feeding the hungry or treating the uncovered, that becomes secondary. Okay, so insurance companies, they get paid more the sicker you are. They do not get paid and I'll take a step back because some people don't see this. They make more money the more claims you generate. The short answer is, I'm going to oversimplify this. They only get to keep 15% more than claims. It's a price fixing thing put in the fully insured large market under Obamacare, that the only way for an insurance company to keep more than 15% of your actual claims is for your claims to grow. I mean, they can't keep more than 15%. They're limited to that. So if they make you healthier and you as an employer generate less claims in a given year, they cannot raise your premium by law. I mean, I'm oversimplifying it because it's calculated state by state, plan by plan. But the reality is insurers want you to generate more claims, want you to be using the system. All right, so how do we fix this mess, right? You got insurers, hospitals, PBMs and big pharma. I'll just put that into one category, whether it's the manufacturer or the prescription benefit manager, government agencies, brokers, medical groups. Well, government agencies, I'm going to pull out for now because there's an element of government agencies we can make use of to help solve the problem. But 30% of healthcare is paid for by private insurance companies anymore in America. 70% of healthcare is paid for by the taxpayers. Let that sink in, right? So government agencies are a huge problem. Medicare, Medicaid, TRICARE, et cetera. HHS, all the bloat that goes into it. So, but that's typically not why you're talking to me, because you're talking to me because you're an employer and you want to save money on your health plan. All right. This is the coolest thing ever. If you work with an independent brokerage, an independent broker, somebody who's not backed by private equity or Wall Street, they can take a longer view. They can take a different view of how they help you. They don't have to show growth every quarter, okay? They can help you solve this problem. So find yourself an independent broker, and you might find a great independently minded broker at a big top 10 insurance agency, and that's helpful. It's not going to solve the problem because the pressure they get from above to continue to sell the same solutions is immense. Trust me, I know. All right, so here's the good news. We have solutions for every one of these problems. We have solutions to fix the broker problem, the government agency problem, the medical group problem, the PBM problem, the hospital, and the insurance company. Let's start with the insurer, the insurance company. Self-insure your plan, self-fund your plan. We will buy you stop-loss insurance out in the market where there's 30 good options. There's probably 70 plus stop loss carriers out there that it's a fraction. It's 10 to 15% of your total premium because it's only going to kick in over a large threshold. So you can self-insure your plan, and we do that with employers all the way down to 100 employees. Very doable. So when you self-insure your plan, you remove those big four insurance companies from influence over your plan, from their desire to keep your claims high. So again, first step, you self-insure the plan. Now the problem is only about 20% of brokers will even look to self-insure. And then of those brokers, more than half of them simply do the kind of the lazy self-insurance where they go to the giant carrier A and they say, hey, can we use your TPA, your PBM, and you get the stop loss and we'll just pay you for claims. And so you get overcharged for everything in that whole pie. It's not the way to self-insure. When you self-insure, you've got to go with an independent TPA, not backed by a carrier or private equity. You got to go with an independent PBM, of which there are many. So again, insuring, you fix the insurance problem, self-insure. 20% of brokers will do it. Maybe 10% will do it well. Okay, how do you fix the PBM, prescription benefit problem? You're not going to fix big pharma, the manufacturers yet. That's a bigger problem, hopefully legislatively, that's coming. But we have a good solution for this. There are something like 60 to 80 different PBMs in the country. You only know of the big three. 90% of these brokers use the big three. Okay, I'm not going to say their names. You know who they are, right? They're aligned with, either owned by or own a big insurer. Those big three make it almost impossible for you to get a good deal, right? There are so many games being played with the rebate dollars funneling through other countries and coming back and labeled as something else. I mean, it is an absolute unbelievable scam, right? So you want to avoid using those big three PBMs. We have a handful. We have a handful of great PBMs that are really good at what they do, 100% transparent, and they get the lowest cost net drug for my clients, and they spend 100% of that rebate back to the client. We have a solution for that. It's great. We've solved the insurer profit margin. We're solving the PBM profit margin. Brokers, I told you how to solve this. Find an independent brokerage that's not under tremendous pressure to grow your premium dollars and hence their revenue every quarter, because the vast majority of brokers are compensated a percentage of your premium, right? So when your premium goes up, they get a pay raise. They love that. You want to negotiate a flat fee for your broker or a PEPM, generally per employee per month, and have that be what you compensate your broker. And then the next step is find an independent broker that's not going to be constantly pressured to rip you off. Okay. All right. Medical groups, the doctors, generally not the problem. Generally, doctors are great. Once doctors understand what we're doing and how we're trying to fix healthcare, they tend to be allies of ours. The one exception would be the giant hospital systems that purchase these medical groups and then own them. And then you have this like hospital medical group monopoly in an area. Those are problematic. So how do we address the hospitals? I've addressed every other problem on your health plan now. There's one problem left that is diabolical. If you were to ask me who the biggest Bond villain in healthcare is, what the hardest problem is, I'd actually have to tell you it's giant monopolistic hospital chains. Why? Because we have a fairly easy direct solution for everything else. The hospital chains are hard because they can ultimately say, we're not going to see you, right? They can ultimately put the brake pads up and say, we won't treat you if you're not going to pay us that bloated rate that is negotiated with one of these four carriers, all right? So here's what happens in the hospital world. And when I say hospital, I'm talking about getting admitted to a hospital. I'm not talking about doctors. The doctor visits are not the issue. I'm talking about going in for a hip surgery, right? Going in for heart surgery, etc. All right. This is how hospital pricing works. The hospitals get together with the insurers. They pretend to fight and hate each other, and they every now and then have squabbles where they'll be out of network for a few months. But what they do is they negotiate, the insurance company, the hospitals, say, oh, our charge master, our list price for a procedure, whatever that procedure is, the CPT code or the DRG code, is X. And X is often 600 to 800% of Medicare. 6 to 8 times What Medicare, the largest purchaser of healthcare in the country, by the way, the largest customer of that hospital is Medicare, 6 to 8 times that. I've seen, I had one this year, 13 times. The list price of the hospital was 13 times Medicare. It's complete highway robbery. There is absolutely zero relation to reality in that world. None. I mean, they just make up the price. They don't even know a lot of times what price they're making up. Because then when I get involved and I'm having to negotiate access, sometimes I'll talk directly to the surgeon and I'll say, are you aware what they're charging for this surgery? And almost always the surgeon is disgusted and horrified and will call the hospital on your behalf and say, that's ridiculous. We can treat this patient for 200% of Medicare, right? So how do you address the hospital pricing issue? Reference-based pricing. Reference-based pricing says, look, I am not playing this game. I'm not going to work off of your bloated charge master price. And then, oh, by the way, the piece I left out is that the carriers, the 4 large carriers, they negotiate a discount off of that 7X Medicare, usually 45 to 55% off. So you're getting like half off, right? It's 700% of Medicare. You're getting half off. You're paying 350%, right? And then you go, whoa, thank goodness, I got half off. I got a deal here, right? No, not a deal. That is the hospital system and the carriers colluding to rip you off and profit on you. Remember, the carriers need you to have high claims to make profit. The hospitals want you to be dependent on them to make high profit. So you have to remove yourself from that altogether. When we get back to when you self-insure, you don't go to carrier A, B, or C and say, can I rent your network and rent your discounts on the hospital side and pay that? No, because that's still the bloated pricing, and that still represents a huge, 50 to 70% of your spend in many cases is this hospital pricing problem. So you say, I'm going to pay a fair amount for hospital services. What is a fair amount? We use different metrics depending on the specialty, the location, everything. It could be anywhere from 120% of Medicare up to 200% of Medicare. Heck, it could even be 250% of Medicare in some cases. It could be 20% more than the self-reported cost of that hospital. You say, well, Craig, how do you know the self-reported cost? It's public data. You can pay a subscription fee and access it because every hospital that wants to be reimbursed by Medicare, Medicare is what we use to pay for the oldsters, has to publish their self-reported costs to CMS. So we can access it. So we know what their self-reported cost is. So one way you address this problem is you say, we will pay you either 125% of Medicare or 120% of your self-reported cost, whichever is greater, right? We're going to pay you 20% more than you're saying your cost or 25% more than your largest customer. All right. Do we have to negotiate above that? Yes. We usually end up 160, 170% of Medicare overall, but your typical plans are paying 250 to 350% of Medicare overall. So what does that mean? We're cutting healthcare plan cost by 24 to 40% year one with reference-based pricing, year one. And then your renewal is not 7, 8, 9, 10%. It's like 2% because Medicare only goes up about 1.5% every year. So how do you solve the healthcare problem? All the steps I laid out here today. The hardest one is reference-based pricing. The hardest one is this. It's the one I've been told by the entities that provide the repricing. There's only about 1% of brokers that do it. And of that 1%, they're not sure how many of them actually know what they're doing. It helps to be an attorney who's litigated in this field before because I know where the landmines are and I know how to win. So again, if you're self-funding and you're doing everything else right, you're getting like 2/3 of the way there, 70% of the way there. But if you're still clinging to a network logo, a big four network logo, I'm not going to say names, big four, you know who they are, you're overpaying for claims dramatically. And the cartel is, in some cases, saying, we won't treat you if you do anything else. Now, that's a whole nother battle that we take on, and we win most of the time. I tell my clients regularly, it takes 3 to 9 months to work out the kinks. We work them out. We either enter into a direct contract with that facility or we add back in a carrier network just for that location so that you're only bleeding at 300% of Medicare on maybe 20% of your population instead of the whole population. We have a number of solutions to do this. And so far, knock on wood, career to date. We've solved all of them that need solving. But that is how you fix healthcare in America. You use the government's own reporting system against the whole system that is colluding against you. And you bring your prices down dramatically. Trying to think of what other questions I get in this vein. I think that's it. I think that's pretty much all of them. Again, insurance companies self-fund. PBMs don't use the big three. Brokers don't use the big 10. Medical groups, they're really not the problem unless they're part of the monopoly, in which case you're going to RBP them anyway. Part of the monopoly being purchased by a monopolistic hospital chain. Okay, all that stuff's easy. 20% of brokers can get you there. It's that last chunk, addressing hospital prices, that will truly set your plan free and will knock your costs down to numbers you didn't think possible. I have one client, and they're all references, by the way. If you're listening to this and you're interested in this, just reach out. We're up to quite a few clients in this lane now. And it's the biggest problem is me explaining this to you on the front end and you thinking it's real. Because when I tell you you're going to save 30% the first year, almost, that's an average. People just don't believe it when it happens. And then we have one where we saved 30% the first year and then like another 16 or 17 the second year. And this is on a per employee per year basis. So it was a head count was taken into a factor. But that's it, folks. That's how you fix healthcare pricing. Look forward to chatting again next time.